Good morning, everyone. Thank you all for being here. It's been a busy morning. Those of us, you're meeting number 3 today, so thank you for your patience. We needed a quorum to start. Today is Wednesday, January 21st. On our agenda this morning is a briefing on the Longevity Ready Maryland Plan. And may we have Secretary Rokes come to the table with Jennifer Crawley, your Deputy Secretary, and Liz Woodward, Assistant Secretary of Planning. Do we need anyone else at the table, Madam Secretary?
No, that's fine, thank you.
Thank you very much. You can begin when you're ready.
Good morning, everyone. Thank you. Thank you for being here, and thank you for letting us come and talk to you about preparing Maryland for longer lives. As Secretary of Aging, this is what I see as really my core responsibility. And I am really pleased to be able to share our thoughts about that with this committee. At MDOA, we have a mandate, a statutory requirement that says that we really are expected to focus on the urgent needs of older people living in Maryland today, but also be looking at the system change that's required for preparing Maryland for many older people living in our state. All of you know we are currently navigating a period of profound demographic and political disruption, with federal changes to programs that have historically provided a safety net for older people, like Social Security, Medicare, Medicaid, and SNAP, and other operational challenges which have been presented by federal government policies. But we're not waiting to see how things will turn out. We're both working on those challenges today, but also thinking ahead for what Maryland will need to do to be prepared for older people to thrive in our state. Our vision at the Maryland Department of Aging is that every Maryland resident will lead a life that is healthy, financially secure, socially connected, and purposeful across their full lifespan. And what we know now is that lifespan may be 100 years. That's the sea change that we're talking about. The role of the Maryland Department of Aging as the designated state unit is to distribute, monitor, and report on the federal and state grant funding that we receive, and most importantly, to plan, advocate, create policy and legislation to address the needs of older Marylanders today and prepare for the future of aging. So today's briefing is to explain our role in planning policy, legislation, and advocacy. And we have been doing that through this model of a multi-sector plan for aging. We're going to try and help you understand a little bit of the details of the plan, but let me just back up for a minute and talk about what we mean by population disruption. Today in Maryland, 2.3 million people are age 50 or older. That makes up 37% of our population. So we have a plan that is a 10-year plan, and if you're 50 today, you will be 60 when this plan is completed. And we're used to thinking of sort of older people as, at that 65-year mark where, eligibility for Medicare occurs. But we have to begin thinking about that big population long before they actually turn 60. In just a few short years here in Maryland, the 60-plus population will make up a quarter of our state's population, with the 85-plus group the fastest growing segment. And that's where we're starting to see centenarians being more of a sort of, oh, you're 100, that's nice. In the old days, it used to be, if you were 100, you got like a letter from the president and they put you on the news, and it was really an extraordinary accomplishment. Now many more of us are going to be able to benefit from the things that have made that possible. Historically in our state also, 18-year-olds far outnumbered 60-year-olds. Today, however, that has really shifted. In Maryland, the number of residents aged 15 to 19 and those aged 60 to 64 are now almost perfectly balanced. And so what we have is a population that no longer looks like it used to, which is a large population of young people and then smaller as it goes up toward greater lengths of life. In 1970, 4 counties in Maryland had 35% or higher population of residents aged 50 and older. And if you look at these slides, if they're doing what they're supposed to do, they are. They're moving along and they're showing that as time goes on, more of the state is that deep green color. And the deep green color tells us that those are areas where 35% of the population is over the age of 50. And so this is happening rapidly, and we already have some counties where the older population already makes up that percentage. So we know these numbers are going to grow, and we know that we need to be thinking about 21st century models for approaching this growing census of older adults. So that brings us to Longevity Ready Maryland, or LRM as we call it, which plays a pivotal role in addressing both the opportunities and the challenges that are associated with a large, growing, older population. We are all really programmed to think about lots of older people being a sort of woe is me thing, and that this is not a good thing for our state, and it's not good for us as individuals. And we really need to start to shape our thinking a little differently if we're going to reap all of the benefits of this growing older population. By embracing an all-of-life course, all-of-government, multi-sector approach to longer lives, we'll be able to ensure Maryland is ready. Maryland has also set a national example by being the first plan in the country to combine our federally required 4-year state plan on aging with our 10-year multi-sector plan on aging. And what this does is this integrates the policies and programs and funding through the federal government that we receive with the ongoing work of the state agency funding policy and programming, rather than having those being siloed and in sort of separate but parallel paths. The launch of Longevity Ready Maryland sends a clear message regarding a shifting of federal policies. Maryland will continue to put the well-being of older residents front and center. And during these very challenging times, when we don't always have a lot of positive news for the residents of Maryland, I think being able to say Maryland has a plan that commits the state to the well-being of older people, their families, and their care providers, and we will stay consistent in our commitment to that. That's good news that we can bring home. So we didn't come up with this plan by ourselves, just like we're not going to be able to execute on it by ourselves. Before submitting LRM to the legislature and the governor last year, we visited every corner of the state, in person and virtually, and we gathered input from a wide group of very diverse stakeholders, community members with lived experience, that's code for older people, experts in health and aging, state agencies, local governments, community-based organizations, and older adults across urban, suburban, and rural areas. One of the really fantastic events that we had was the virtual town hall, where we had over 4,000 people participate. That, I think, tells us a little bit about what the residents of Maryland are thinking about and concerned about. So the plan has 4 epic goals, which include building a longevity ecosystem where housing, healthcare, and community services are interconnected, promoting economic opportunity by reframing older adults as economic drivers and strengthening our care workforce, preparing Marylanders to afford longevity through financial literacy and innovative, affordable housing and healthcare models, and optimizing health, wellness, and mobility so Marylanders can enjoy long, independent lives with, very importantly, health spans that match their longer lifespans. This plan itself is designed to be dynamic and to change in ways that reflect evolving conditions. Continuous monitoring, updating, reporting, and stakeholder engagement will ensure that it remains relevant. However, our commitment to the Longevity Ready Maryland multi-sector plan framework will be constant throughout the 10-year period. Earlier this month, we submitted our first Longevity Ready Maryland annual report to the governor's office, highlighting our significant foundational work through 24 and 25. Maryland was one of 4 states that was awarded a competitive $490,000 caregiving strategy grant from the Administration for Community Living. This was to improve awareness of resources across the state and local agencies among Maryland's diverse population of caregivers. We've worked to build an online assessment and resource navigation tool. We've created an ambassador program to increase outreach among underserved caregivers, and we have assessed caregivers' need to improve cross-agency resource allocation and policymaking. MDOA has directed $220,000 in aging in place grants to align with child poverty targets, the areas of the ENOUGH grants that have been targeted, supporting state investment in a full lifespan approach within under-resourced communities. This makes really good sense because many of the children in those communities where they are living in poverty are being cared for by their grandparents. We have redesigned MDOA's pre-Medicaid long-term services and supports program into one $20 million service initiative called SOAR, with the goal of being more efficient and effective and reaching more older people in need. We've piloted a memory care family checklist with Johns Hopkins. It is going to be released later this month, and it is a checklist that is free, personalized, and connects individuals to resources that they need as a family caregiver. So looking ahead, we have several priorities for fiscal year 26 in the plan. We've pulled out caregiver support, healthy nutrition and food access, and Maryland No Wrong Door access to services. We also have, as an agency, plans to codify Longevity Ready Maryland into law, and we're going to come talk to this committee about that next week. We are increasing our stakeholder engagement, and we're working to build philanthropic partnerships so that we can develop alternative funding streams for our many programs and policies. So LRM has 78 recommendations, and that's way too many recommendations to review with you today. So what we did was we pulled out a few examples that we thought would be relevant to give you a sense of how this works. To see the full list of LRM objectives, goals, and recommendations, I invite you to visit lrmmaryland.gov. And if you don't have time to read through the whole plan, I invite you to read the Longevity Ready Maryland Annual Report. The annual report clearly lays out the 4 EPIC goals, objectives for the goals, strategies to meet the goals, and an overview of progress to date. So one of the EPIC goals that we'll talk about today is promoting economic opportunity. And I know everyone knows that Maryland is very focused on growing our economy. With this goal in mind, one of the things we know we need to do is strengthen Maryland's commitment to family caregivers. The state's 760,000 unpaid caregivers provide essential support to our state's long-term care infrastructure. They offer 710 million hours of unpaid care, and we know that 7 in 10 caregivers work part or full-time, as well as have caregiving responsibilities. 40% of caregivers now perform complex medical tasks, and unfortunately, many of those do that without any training in how to provide that care. One way to achieve this is to continue improving Maryland's No Wrong Door access for information and supports for family caregivers. And we've done this through the partnership we now have with 211 by developing an AI chatbot for folks who access the website, and by collaborating with Maryland One Benefits to ensure older adults are included in the state's universal application screener. We must also continue collaborating across state agencies to formulate policy that increases opportunities for people to work more years with more flexibility. One of the things that we know is that one of the fastest growing segments of the labor force is people over the age of 65. And this is happening because there are more people in that age group. There are more people in that age group that need to work to afford a longer life. And there are many people who want to work, like some of us 70-year-olds. And so we're seeing more and more of that as we move forward. One of the recommendations we also have is to consider adopting the Certified Age-Friendly Employer, or CAFE designation. This is a national standard managed by the Age-Friendly Institute, and it provides a roadmap for organizations, including governments, to recruit, retain, and value experienced workers. We think that if we also further leverage skills-based hiring, apprenticeships for all ages, and more pathways for workers age 40 and older to pursue career changes to in-demand occupations like healthcare, education, and IT, that we will help meet this goal of promoting economic opportunity. And right here in Maryland, one of the things that we saw that's an example of this is with the many federal workers that lost their federal jobs, we repurposed those workers and we created a pathway for them to become educators and to help us fill our vacancies, our teacher vacancies in the state. That is a great example of how this can work to our benefit. One of our main goals is also optimizing health, wellness, and mobility, and this has to do with making sure our health spans meet our lifespans. And right now, many older adults can expect to live 8 years in poor health. So we're living longer, but we're not healthy in all of those years. And we really need to be able to close that gap. And so we know exploring ways that we can have a holistic healthcare system is one of the things that we need to be able to do. We also are looking at alternatives for institutional care. So there are a lot of concerns right now about affordability of assisted living and nursing home care, out of reach for many Marylanders. And we're thinking about ways that we can collaborate to deliver more community-based options for older people, as well as really looking at different models for institutional care. And so we have a report that we conducted last year on looking at the greenhouse or small household model for nursing homes. We've begun this work also through our SOAR program by redesigning our pre-Medicaid dollars, state dollars, as well as supporting the Capable model and the AHEAD model and the Rural Health Transformation model, all of which are being launched in our state, all of which greatly impact older people. So we're going to continue to participate and influence these initiatives to ensure that as they unfold, older people are centered in the decisions and the discussions. So I'm not going to go into it in detail today, but we are going to propose that there be a Longevity Ready Maryland Act. And what this will do is codify into law the framework for preparing Maryland to be longevity ready. And we need to ensure that the progress we've made to date that I talked about isn't temporary, and that this isn't just a little flash in the pan, but that we realize that we must, as a state, stay committed to being prepared for longer lives. So the features of the Longevity Ready Maryland Act include establishing Longevity Ready Maryland in a permanent, broader work of the Department on Aging, expanding the role of the Maryland Commission on Aging to become the Longevity Ready Maryland Implementation Advisory Group, and requiring comprehensive updates every 4 years, accompanied by a publicly available annual progress report. In addition to the Longevity Ready Maryland Act, the Department of Aging is also supporting legislation from our sister agencies, and that includes the DHCD Starter Homes and Silver Homes Act. I cannot begin to tell you how pleased we are at the department that when we think about affordable housing in Maryland, and when we work with our Department of Housing and Community Development, they recognized that we need starter homes for young people and families, and we need silver homes for people who are no longer needing to live in maybe the house they built or lived in to raise their family, and need to have an affordable, safe, accessible place to live. And we are really thrilled to be working with the Department of Housing and Community Development on this. So, what are our asks? And I actually thought about the fact I'm not sure you're supposed to ask the committee for anything, but I'm going to lay out what we'd like you to be thinking about. One is we'd like you to adopt the longevity lens when you are doing your work this session. And by that we mean think about the full lifespan approach, recognizing that, life doesn't suddenly pause at 65, and that for many Marylanders, there may be up to 40 years of life after they retire. And we'd also like you to think about amplifying the Longevity Ready Maryland plan. So the plan has marvelous recommendations, strategies, objectives. But as you are going about your work, if you look at the plan and you see things in there that you think need to be elevated, we hope that you will use the plan to do that. And we also will need your help in implementing this. So my great hope is that I will sit before you many years to come, and we will talk about Longevity Ready Maryland, and you will see future bills, funding, policy that are directly related to the fact that we have a Longevity Ready Maryland law in place. And so on that note, I will close my remarks, and I'm so happy to answer any questions and also to get feedback, because we're trying to make this whole idea about preparing for longer lives something tangible that people can understand, not just something abstract. And it was one of the reasons why we tried to pull out some examples so that this could seem, it's not just some pretty words, it's like there's real things that can happen if we take this approach. So thank you very much.
Thank you, Madam Secretary. Is anyone else going to present?
No presenting.
Okay, thank you. Do I have any questions for the Secretary? Senator Ellis.
Well, thank you, Madam Chairman. Thank you, Madam Secretary, for your presentation and for meeting me later last year and talk about some of these big issues. You have a big job, and it's a very important job. And I have a couple questions. So with the population age chart you had up, in our pack is just for 1970, but you flip through some other, especially the current population distribution by age on the screen right there. So it seemed like there's some counties that have the population range over 50 is over 50%. Is that true?
What, I'll let you speak.
I don't know if you could go back to that.
Yeah, we can go back to it.
Because we can watch the, this, by the way, is on our LRM website. So it's part of the data that we provide for the public.
Yeah. So that's 1970, 80.
And it goes
19
by each decade up
Okay.
to.
So we get to as close to current as possible. Okay. Thank you for amplifying that. 2020. So that's a projection for 2030. So you have, like Talbot County will be at over 50%. Oh, okay, and then it starts over. So could you hold it on the, like the 2030?
I'm not sure how to do that.
Oh,
I'm sorry.
I'm sorry. Okay, I didn't mean to challenge you.
Sorry.
Okay, but, okay, I see. But there are few counties that are projected to be over 50%, and which is really, would be a tremendous opportunity for us. And so my question is not just responding to the aging population, but planning for a healthy Asian population. I mean, you work with like the, I think they call it like the blue zones. And so could you talk about that and if you are looking at anything proactively in that area, working with blue zone, tell us what it is. And can you do that, please?
Thank you for the question.
Okay, sure.
So blue zones are a fascinating phenomenon. And across the world, there are several areas across the world where there are blue zones. The United States has one, and it's in San Diego. And in blue zones, there are disproportionate numbers of people who live well into their 90s and frequently to 100 or more, and remain very healthy all the way to the end of their life. And so researchers have looked at this and tried to understand, well, what is going on with these people? Is it, is it something special genetically and what they've determined is that it's more related to the social determinants of health and to also the environment being healthy. So not a lot of pollution, air, water, otherwise. Very tight-knit social communities. So people say socially connected through their whole life. They don't suddenly sort of disappear as they age. They look at what some of these folks eat, and they typically eat diets that we now know are likely to help reduce the chronic illnesses of late life, diabetes, heart disease, dementia. And they are very active. They continue working. So when we think about, creating the circumstances for people to be healthy, it's everything together. It's not one thing. And it's not a silver bullet. Now, one of the things that's happening in medicine right now is this longevity medicine, which is very focused on this idea that, well, you can take certain supplements, inject certain drugs, eat certain things, and do certain kinds of exercises, and you're going to be able to prolong your life and not see just sort of normal aging even. I think that we're a very long way away from that being something that's readily available or even well documented in terms of science. But what we do know is that growing older does not mean you have to be sick. And we have always confounded being sick, being chronically ill, with being old. And so what we want to do is through the programs we have, but across the agencies, create the environment where people can thrive, where they're going to have the things that they need to avoid the illnesses that compromise them in later life, and to be able to stay socially engaged and connected to their communities, and to work if they want to. It's going to take all of government. It's not something the Department on Aging can do. And we're already working on some of those things. So I think that's part of it. It isn't like we need to have a huge infusion of money. All of the agencies have various goals in their plans. The Longevity Ready Maryland Plan is based on other state agencies' stated goals. All of them have goals that if we collectively move forward on them, we will prepare the state to be longevity ready. I hope that answered.
It more than answered. Thank you, ma'am. And thank you, Madam Chair.
Senator Washington?
Thank you, Madam Chair, and thank you, Madam Secretary, for being here with us. And it's a great presentation, too. I'm on your page or the slideshow. Well, first off, we don't have that very nice graphic that you have on yours. It just has the one page from 1970. So when you were going through, I was kind of confused, but well done on your graphic designer that did that for you guys. But I'm looking at key departmental bills, and I think it's SB 36 and HB 239. You know, some of these things in here are really good, and talking about housing affordability and ensuring that we're investing in smaller footprint, smaller square footage homes for seniors to be able to live in. You know, the thing that I hear from seniors all the time that are aging in place and in their current homes are, what can you do to help me fix my current home? Whether it's my step, the railing, the HVAC unit. I hear that all the time about HVAC. So we do a lot of Christmas in April, which is the one big thing we can offer to our constituents. But every time someone asks me that question, it's hard to find resources for this person over 50 or 60 years old. The question is, will this bill cover any of that, or has potential for it? I know we have a fiscal deficit this year, but I mean, we're talking about really having an impact on seniors' affordability. It's honestly staying in their homes where they are right now without selling their home or refinancing their home at the moment. So I wonder if this bill tackles that key issue of seniors aging in place in their current homes.
Yeah, sure. So good morning.
Good morning.
So this is DHCD's bill, recognizing the need for more affordable housing here in the state. And so I can't speak to the details of this specific bill as it relates to the home modifications that you're describing. But I can speak to aging in place and that the resources that are available. We have the Maryland Access Point, also known as MAP, which is our information and assistance hotline, if you will, that is operated across all jurisdictions through our network of 19 area agencies on aging. And these are really our experts who can help individuals who desire to age in place access the resources that you described, because it is a challenging system to navigate. And many of these resources, like you noted, Christmas in April, which is also Rebuilding Together. There's also public available programs that offer either low cost or no cost loans and grants and things of that nature. And MAP is really the first place to go because we'd like to think if you have questions, they have answers. The other piece that is really critical, in addition to sort of those basic affordable care needs that you're talking about, like HVAC systems and things like that, are home modifications that really promote independence. And we are promoting and in support of the Capable model, which is really about doing a home environment assessment, looking at what can be implemented that allows for the environment to be safer, and to allow people to really be able to age in the environment in which they desire. So maybe a raised toilet seat, a grab bar, ramps, things of that nature. And we've actually been very successful in partnership with DHCD to increase that model here in particularly our rural areas of the state.
You said that those two resources, one calling the Maryland Access Point, understanding that and using that as a resource for seniors to go then, and then they will point them to the right direction.
Absolutely.
But I don't want to have to point them to that. I don't want to have them to go through that. I would like to give them the answer. Hey, call this number for this particular resource. And you maybe offline you can give me those resources and what those are, so I can inform my constituency and the whole state that these are really important pieces for them to take a part of. And if you can, then if you can give me the information on whatever program there is at DHCD that's being used for these home modifications, I think that'll be really helpful because these seniors can't seem to find it.
We, unfortunately, the Area Agency on Aging Network is one of the best kept secrets, not for a lack of trying, to promote the availability of this incredible resource across the state. The number that you can tell your constituents right off the bat is 211.
Yeah, right.
We have a partnership with them to provide this assistance, and then they can connect to the local map.
Okay. All right. Thank you.
Yeah, thank you.
Senator Kramer.
Thank you, Madam Chair, and always a pleasure to see you, Madam Secretary. Thank you for the presentation. And just a quick follow-up, because Senator Washington refreshed my recollection that there was an effort within the department previously to develop in the local jurisdictions a sort of, and I think it was Communities for Life, do I recall that correctly? With the goal being that there would be vetted home improvement businesses that would, be approved to come in and do work in seniors' homes, and that there would be an understanding that they were approved and would come in and do the work at a value price, and that in some instances it could be the community members, the participants, would contribute a flat fee. However, it was done either monthly, annually, and in return for that fee, they would receive these approved contractors who would come in and fix a running toilet. They would come in and they'd replace a light bulb that was burned out, creating a dangerous scenario of dark areas within the home where because we know tripping, of course, is one of the huge hazards for our senior population, and minimizing that, to your point about doing a home audit and looking for those things that could well be a potential source of harm. But I agree to the point that Senator Washington was making is, do we have or can, as part of the effort on this, the opportunity to provide, these kinds of opportunities and services so that we do more than just pay lip service to helping senior, to say seniors should be able to age in place, but that we are actively pursuing how that might look, how it might happen, and how that we can ensure that we are doing that. And, look, I understand There are things that cost money, and, you know, where our budget is a reflection of what the priorities are of this governor and our legislature, you know, in an effort to look for opportunities to employ those very individuals you were mentioning. The first thing that comes to mind for me is we've had success in the past in providing tax credits to those businesses that have been willing to hire ex-offenders and our residents with special needs. And are there opportunities to look at, well, if we want to incentivize businesses so that we can help get those who are retired or would not like to be retired, but were kind of pushed in that direction, get them back in the workforce. And, you know, what does that look like, and how we might accomplish that with the understanding that, yeah, we're making an investment, but what is the return on the investment, so that we realize, yes, this is the path we want to pursue, and there will be something in the budget or less in the budget if, you know, in the case of providing tax credits, but what are the benefits? What's the upside then if we can get these people back in the workforce and get them paying income taxes? And so you know, if we're looking in that direction, you know, I hope that'll be all part of the process.
So thank you for laying that out, because I think that you have identified exactly what we are hoping to do through the Longevity Ready Maryland plan and the bill. We are not, there is no fiscal impact from the bill that we're proposing, because our approach is going to be what currently exists. Are we leveraging it to the fullest? Are we doing this work of connecting that we were sort of hearing about, so people actually know what's available? And what are the models that have worked in other states perhaps, or even in our own state with other constituencies, to sort of get us to the place we want to be? I think the fact that we already have skills-based hiring and we have apprenticeship programs, and that we have been so clear and worked so hard with the Labor Department to help them understand apprenticeships should be for everyone, not just young people. And skills-based hiring lets us have that flexibility with bringing people in who maybe don't have that credential but have 20 years of experience. So we already have some things in place that in my view, Senator Kramer, our goal this year, and probably the year after that even, as we're doing the first years of the plan, is going to be use the assets we have and leverage them effectively and efficiently. With the Communities for Life program, which I'm very familiar with because I was one of the CEOs of an organization that took that program on when our former secretary initiated that. We have a final report that's been produced regarding the Communities for Life program, and I'll make sure you have it if you haven't seen it. But that program was a Medicaid demonstration program. That's how we funded it. And the funding is gone. And what didn't happen, that was sort of the intent in the model, was that the not-for-profits who engaged in this demonstration project, the idea was that they would be able to pick up the piece that had been paid for through the Medicaid funds, and they weren't able to do it. It was too expensive in the end. The other thing that was interesting was the service that was most requested through the years of the program was transportation. So we learned some really important things through the demonstration project. There are in place now, both at the county level and I think also at some municipalities levels, programs that are structured around specifically helping people update and upgrade their homes. And one of the things that we are consistently working on is that historically many of those programs are made possible by philanthropic funding. And we're looking at what are the possibilities that they can be funded through Medicare for the Capable Project or Medicaid. And so that's a whole, as you know.
I think it's important to try to look for those opportunities to think outside of the box,
Yeah.
get creative on how we may best be able to utilize those resources. And interestingly enough, this committee will be meeting with Uber later this very day. And maybe it's an opportunity to discuss how we can look at Uber and Lyft helping in light of your comments about transportation being a very important need
Yes.
of our senior residents. So thank you.
Thank you for that.
Thank you, Madam Chair.
Senator Lamb.
Thank you, Madam Chair. Thank you, Madam Secretary. Good to see you again. And had a question about kind of just funding for local departments, local areas on aging. And, I know the governor's budget's coming out later today or has come out just recently, but are you able to give us a sense of what we should be expecting in terms of changes to these local areas of aging and their basic funding and, kind of based on the formulas that we have seen in the past?
So I haven't seen the full budget yet, but we do know the challenging times that we are navigating. Currently, for the coming fiscal year, our expectation is that the funding to the local area agencies on aging, the federal funding is flat funded, and we have been successful. We're continuing to receive that funding from ACL and draw that down. It hasn't increased, but it's not, there haven't been big decreases in the federal funding that we distribute to the local area agencies on aging through an approved funding formula in the state. The state funds at this point remain the same as far as I know, and those funds will also be distributed according to the funding formula that's been approved. One of the programs, it isn't the funding, it's the way the funding will flow. One of the programs, which is the congregate housing program, is carved out a little bit so that we can address making sure their funding flows directly to those congregate housing buildings, which is how it is now. It doesn't go to the area agency on aging. So our assumption is, and we've shared what we've shared with our area agencies on aging, which is for most part county governments, for not-for-profits in the 19, is that we anticipate the formula will be the same for the coming year. As we work through the SOAR initiative and implementation, that bill was passed last year, one of the things that we'll be doing and have been doing is looking at whether or not it's the funding formula that needs adjustment, or if it's just a matter of how the funding is used at the local level. And that is not predetermined for this fiscal year. So the fiscal year we're entering is still looking pretty much like it did last year, unless there have been major cuts to my budget that I don't know about yet, and we'll know today.
Okay. All right. Thank you.
Thank you. And I think finally, Vice Chair Hayes.
Thank you, Madam Chair, and thank you, Madam Secretary, for your presentation. I also just wanted to add, over the interim, you and your team have been very supportive and very responsive, and I appreciate that as we work through issues with our constituents. One of the plan's goals is to support like multi-generational workforce or whatever. I'm curious at how do you believe this initiative will address workforce shortages and aging while ensuring equity as it relates to long-term stability, sustainability, I'm sorry.
Let me make sure I understand the question. Are you asking about
So I know that
care workers?
right. So I know that there's the plan calls for like addressing multi-generational workforce,
Yeah.
right? And already in our environment, there's a workforce shortage, and also and even more so as it relates to some of our older citizens. And so I was curious at how do you in an environment where you already have these shortages exist, have there been any thought given to what steps might be taken to make sure that, as we look towards filling the workforce, that we are able to address that issue?
So we've had significant conversations with the Labor Department about this, which is this is their area of focus and expertise. And one of the discussions around multi-generational workforces is this idea that rather than just sort of moving older people out of the workforce, retaining them, and at the same time keeping younger workers encouraged and happy with their employment. And by doing that in a way that keeps the older workers in place, maybe lets them modify their work schedules, maybe modifies some of what they're doing, and also creates teams of people that are made up of older people and younger people. And across the world, actually, this has been done, and there's research that shows that when you have teams that are made up of older people and younger people, they're more productive. And so I think that's where, when we think about this, CAFE certification, which is, being an age-friendly employer, there are specific pathways to really encourage both organizations but also state government to create models that would work. I know when it comes to healthcare that we have a physician shortage, we have a nursing shortage, and we have a big frontline worker shortage. And I know this is going to sound maybe, I don't mean it to sound flippant, but part of the problem is we've made those not good jobs. There are people who want to serve in those capacities, but when the work environment or the pay don't work out for people, they go to into other sectors. And it's well documented, and we know that's happening. We also know our current immigration policies mean that we have an extreme shortage that has been brought about by the current immigration policies. So there is some work being done. For instance, and I don't have the details on this, but I could get them for you, encouraging nurses not to retire, but to stay on, and maybe changing their work schedule or some of their actual activities. Nursing, bedside nursing, is physically incredibly demanding. And so you might have a really accomplished, experienced 55-year-old nurse who's like, I'm going to have to stop bedside nursing. Well, partnering her up with a young new nurse and finding ways to sort of spread that workload, using technology to help with the kinds of hard physical labor part of the job, all of those things make it a better job and encourage a person to stay. And so those are the kinds of things that are being looked at. Why are people leaving? Why are they not joining? And what can we do to make these good jobs, so people want them?
Well, Senator Kyle.
Thank you, Madam Chair. Thank you, Madam Secretary, for this presentation. You know, I recently visited a constituent, an elderly woman in her home, and she was in a nursing home, I think for maybe about a year, 18 months or something thereabouts. And her adult daughter learned that there were supports available for her to move her mom back home with her. And but the one issue that they discovered is it took a really long time for that waiver to get approved. And they talked about a couple other frustrations. And so in the meantime, mom was in the nursing home where they were going through that process. And the agency was present too when we had this conversation. So I'm wondering if you could speak a little bit about, and I apologize if some of this you've already gone over, if you could speak about that timeline process.
It sounds like you're referring to the community options
Yes.
Medicaid waiver.
Yep.
Yeah. So that that is a wonderful program that is operated by MDH and is an alternative to nursing facility level of care. It does have a very extensive registry of about 25,000 people. Priority is given, there's a whole priority process, and priority is given to people who are currently in a long-term care facility and wish to move back into the community. And it is a very extensive process that requires assessment, requires meeting financial and functional eligibility, and then working your way through that registry process, along with identifying the support planners and getting plans of care approved and things like that. It is an area where there could be improvement. And I believe that as we are looking at improving the continuum of care that exists, like with providing lighter touch interventions in the community that ultimately delay people becoming disabled, and really getting people the right care at the right time with the right provider is essential to helping reduce those wait times and the challenges of access that you're describing.
Yeah. I mean, because they, you know, not to be really blunt, but they rightfully so explained it's not like her mom has a lot of time left, you know?
Yeah.
And when they were really concerned about the time while they waited. And, you know, it was frustrating for them. And then also along that same lines, they were similarly frustrated that that they weren't aware that this option was available to them when they were trying to decide, you know, that mom was getting to the condition that they weren't necessarily able to solely take care of her in the home. And there were discussions among the adult children who was going to be the one that was going to do this, where they're going to take turns, but they weren't even aware. I don't know if there's like that kind of information, if there's, you know, that's communicate, how does that get out to people that these options are available and supports are available if they choose to keep, you know, their loved ones at home?
Yeah, so it is very tricky to know about this information. And what one of the challenges is until you need it, a lot of times people don't know that these services exist because for a variety of reasons. I will just emphasize that the area agencies on aging, or also the AAAs, are honestly the best resource, as well as, and do a ton of outreach, both through the local ombudsman program, providing information about what kind of options exist, whether they be Medicaid funded or state funded or even privately funded, and also the nursing home discharge planners and things of that nature are to be providing education and to be asking as part of the assessment process what matters to the people who they are seeing, and devising a plan with a caregiver, with the person, to really outline what would help achieve those goals of what matters. And that's part of considering like age-friendly care and things of that nature. And at the same time, to be perfectly honest, the long-term care system is incredibly challenging to navigate. It is hard, it is complex. There are eligibility guidelines that vary dramatically based on state, based on whether or not it's federally funded or state funded, or even, and really at the end of the day, this country does not have a long-term care system. And so it is on family members and caregivers to figure this out. And that is what Longevity Ready Maryland is about, is how do we make information more accessible? What are the policies and procedures and even the policy levers that we can pull to address the situations like what you describe? As well as, and Senator Kramer, you said this, this is also about where our priorities are as a state and what we choose to allocate resources to.
Yeah. Well, thank you. Thank you, Madam Chair.
Thank you. I just want to close by saying, I'm taking care of my third elderly relative, and we needed help with a ramp. And so I called the Anne Arundel County Department of Aging, who sent me information and then referred me to Anne Arundel Community Development Services about the low interest or no interest loans. And so for those of you that have a county Department of Aging, that's sort of a good way to start, because they know who the local resources are. So I would just suggest that too. Thank you all very much. We have a noon joint hearing in the joint hearing room. And so in between, the property and casualty folks are at the Calvert House if you want to stop by there. But hopefully see everybody in noon on time at the joint hearing room. Thank you. Thank you, Madam Secretary.